Hi guys, welcome to my YouTube channel. If you're new to this channel, please subscribe and turn on your notification bell so you're gonna know whenever I drop a new video. After subscribing, put it down in the comment section by writing I subscribe. And to my wonderful returning subscribers, you guys are the best. In today's video, we'll be talking about peptic ulcer diseases, but I'm just going to summarize it, talk little about everything in this topic. In my next video, I'll be talking about peptic ulcer diseases in full details. So make sure you watch till the end of this video. I'll be right back. Peptic ulcer disease is just an umbrella name that represents any ulcer affecting the gastrointestinal tract, like esophagus, gastrix, that is a stomach, or duodenum. So peptic ulcer disease is an ulceration of the gastric mucosa, that is gastric ulcer, or that of duodenum, which is duodenal ulcer. Normally, there is a protective layer in the stomach mucosa that produces mucus and bicarbonate that neutralizes the acid, that is hydrochloric acid, so that it will not cause ulceration. But when some things are taken, it kind of deprive or destroy these protective layers, like when you take steroid, example prednisolone, too much, excessive of everything is not good. If you take NSAID, that is non-steroidal anti-inflammatory drugs like ibuprofen, Felvin, always, it tends to break down this protective layer, which now makes it incapable of producing that mucus and bicarbonate that neutralizes the acid. And when a bacteria comes in, this Helicobacter pylori comes in and eat off this protective layer or destroys the protective layer. That is when you have this peptic ulcer disease. And others, when there is this Ellison-Zollinger diseases, whereby there is production of gastrin, which now leads to excessive production of hydrochloric acid that cause the ulceration of the stomach mucosa. This Ellison-Zollinger syndrome can be caused by stress. It can be caused by food consumption, like too much caffeine and spicy food, and it's not good to take the caffeinated drinks and tea also. And when there is alcohol consumption, too much alcohol and smoking, it leads to an increase in the production of hydrochloric acid that cause ulceration of gastric mucosa or that of the duodenum. So what are the signs and symptoms that can be presented by someone with this peptic ulcer disease? The person will be having epigastric discomfort or pain. There will be nausea and vomiting. There will be hematemesis, that is coughing out of blood. There will be manella, that is black terry stew, because of the digested blood, and there will be dyspepsia, which is indigestion. The difference between gastric ulcer and duodenal ulcer is how the food passes through the GIT. Food worsens gastric ulcer, while food improves duodenal ulcer. Why? Because food irritates gastric mucosa. Why? Acid food now helps to move acid from the stomach into the duodenum. That is why if you have duodenal ulcer, you don't feel the pain immediately you eat. When you eat, it tends to stop. And another thing is, if you're having duodenal ulcer, the pain, you feel the pain at the back. It kind of goes to the back. How can this peptic ulcer be diagnosed? First, physical examination. In the signs and symptoms, we said the person will have epigastric discomfort or pain, and the person will be vomiting, and this nausea and vomiting will kind of show in patient weight loss if it's kind of excess. And second one, you have to do barium study in order to detect this ulcer, and biopsy. Biopsy can also show its endoscopy, visualization of the inner layer with a microscope. Stool examination, because we said the patient will have malala, so we have to collect the specimen that is stool to detect peptic ulcer disease. Secretory test, because we said peptic ulcer disease can be caused when the patient is having Zolinga syndrome. There is excess production of gastrin. So gastric secretory studies can show an abnormality in the production of or stimulation of gastrin. The management, you can use the causes to manage this patient. We said stress can cause it, alcohol consumption, some food you eat that is spicy food, caffeinated drinks, and also decaffeinated drinks. We also talked about smoking can cause it. So how to manage it? Number one, you stop smoking. Reduction of smoking, reduction in alcohol consumption. You cut down your spicy food. You stop decaffeinated drinks and caffeinated drinks. These are dietary modification. You stop or reduce anxiety, which can lead to stress or which can alter the way your hormone produce gastrin. We now go to pharmacological. Means if the peptic ulcer disease is as a result of bacteria, that is Helicobacter pylori, we now use antibiotics to treat it. But you can now bring all this proton pump inhibitor like cimetidine, histamine receptor antagonist, which omeprazole is one of them. What are the complications of this peptic ulcer diseases? Number one, bleeding. Too much bleeding can lead to anemia, that is iron deficiency anemia. Another one can lead to pyloric obstruction and pyloric stenosis. It can lead to scarring and scritchel, and ogakwatakwata of them all is perforation. It can lead to perforation, creating a hole inside and leading to peritonitis. What are the food to avoid? Number one, I know say you like chocolate, but if you have ulcer, you have to avoid it. Another one, fatty food. Meat with high fat content. Can they like ritozo? If you have ulcer, you have to avoid eating this. Tomato or tomatoes is not good. Citrus fruits like orange, it contain ascorbic acid, and caffeinated and decaffeinated drinks. Beverages that contain alcohol, you have to avoid them. Spicy food, and I like Ulcer, it's not for you, baby. Just calm down, you have ulcer. So before you take drug, try and do all this dietary modification, because there's no point when you keep stressing yourself or in ulcer, but you do not know that it's caused by increase in gastric secretion, but you're stressing yourself, which means there's no way it can go. But if you start from dietary modification, reducing stress, and you now add up pharmacology way, like drugs, it will work effectively. So you are what you eat. And for others that do not have peptic ulcer diseases, peptic ulcer, all the very, very bad. So you have to stay away from steroid, too much usage of steroid. Too much of it is not good. And now diclofenac, small thing, Mary, more diclofenac, ibuprofen, it's not good. It's up the protective layer of the gastric stomach or that of duodenum. So know what to take. There are some things that does not need medications. Easy worry, sleep. If it does not stop, then you can take drugs. But overall, small little thing you go and take drug is not advisable. So in my next video, I'll be talking you through full details of this peptic ulcer disease, because I just got some of the gist parts of style now, but I don't have enough time. I just want to give you hints so that you understand it when I'm teaching the peptic ulcer disease. Have you subscribed to my YouTube channel? Go and subscribe.